Good afternoon, everyone. I'm Yingying Chang. I'm a periodontal specialist at National Chang University Hospital. And it's an honor to present today, and I would like to share the clinical application of collagen materials in various soft and hard tissue defects. And as a periodontal specialist, it is common to have periodontal and peri-implant plastic surgeries. In natural teeth, gingival resection is a common condition to have root coverage procedure, such as coronal advanced flap combined with connective tissue grafts. And on the left is the initial intraoral photo with obvious gingival resection in the upper left quadrant. And on the right is the photo after split full split thickening is flap reflection and the connective tissue graft placement. And here we can see the coronally advanced flap covering the region of resection. And this is the intraoral photo at 3.5 months follow-up. And another condition to have periodontal or plastic surgery with soft tissue grafts is to increase keratinize gingival width before orthodontic treatment, especially in the lower anterior area. And this is the intraoral photo at 4 months follow-up, and it shows a great result. Soft tissue grafting procedures are increasingly performed for a number of indications in conjunction with dental implant therapy. And this is a case which had an augmentation of soft tissue volume with connective tissue grafts and avoided a secondary healing of wound. 2 millimeter thickness of rich mucosa is required to allow stable soft tissue attachment to be formed and to reduce bone resorption after implant placement. And sometimes I use pedicle soft tissue grafts for wound closure during heliobulbar placement to avoid peri-implant bone exposure. A 2 millimeter of keratinized tissue around implant has been proposed as a requirement for efficient oral hygiene and long-term tissue stability. In this case, an apical positioned flap combined with gingival graft was applied at the buccal aspect of implant 1/6 to gain keratinized mucosa width. And this is the intraoral photo and 1.5 months follow-up. It shows a favorable outcome. And from the above cases, we all know that connective tissue grafts or free gingival grafts are gold standard grafts to use. These grafts can establish short and long-term favorable biological, functional, and aesthetic outcomes. And they also can maintain long-term stability. However, a major disadvantage of harvesting autologous tissue is the limited graft size, patients' discomfort and pain, a secondary surgical site, and a post-operative complication of donor site, such like bleeding, numbness, and tissue necrosis. And so alternative to autologous soft tissue graft have been a focus for a few years. The development of surrogate biomaterials can reduce the surgical morbidity, reduce the surgical time, and increase the acceptance of the treatments. Based on their origin, this biomaterial can be classified as allogenic, xenogeneic, and alloplastic. And these collagen-based matrices are already being used clinically. This soft tissue replacement material can be used for coverage of Miller class 1 and 2 resection defects, the regeneration of keratinized mucosa in open healing situations, tissue thickening. And the collagen matrices of xenogeneic origin are the focus of today's talk. There are 4 kinds of xenogeneic collagen matrices. Bilayered collagen matrix, such as mucograft, is a non-cross-linked resorbable biomatrix composed of collagen type 1 and type 3. Modern stable collagen matrix, such as FibroGuide, is made of collagen and undergoes a cross-linking, providing volume stability and some elasticity at the same time. Xenogenic cellular dermal matrix, such as mucoderm, is a collagen matrix obtained from frozen dermis after a multi-step process, removing all the antigenic components. Extracellular matrix, such as Steiner matrix, is a three-dimensional structure protein-derived matrix from the submucosa of a small intestine in a cell-free procurement. While the natural composition of the matrix molecules is preserved. And xenogenic collagen matrices have been proposed as an alternative to the connective tissue grafts. Several studies have investigated the clinical outcome of mucograft and the mucoderm in plastic peri-implant surgery. And these studies have shown favorable clinical results. And in these biomaterials, mucoderm is very close to ABC color, which I'm going to introduce in the clinical application later. Because there are few dental studies with ABC color applications, so I will first introduce the literature that uses mucoderm. This literature review is to investigate whether the use of xenogenic collagen matrix and the collagen-based matrix derived from frozen dermis, this is mucoderm, provides a similar outcome of connective tissue grafts in peri-implant soft tissue augmentation procedure, and to critically analyze the available evidence. And the result of this literature review suggests that the use of collagen-based matrix derived from frozen dermis, such as mucoderm, is effective in increasing peri-implant keratinized mucosa width and the soft tissue thickness around implants. Nevertheless, further studies are required to evaluate the long-term outcomes. In another study presented by Papi, mucoderm was used to improve the keratinized mucosa width around the inserted implants. It showed that the keratinized mucosa width was 7.86 millimeter after 1 month, and 5.67 millimeter after 1 year. The keratinized mucosa width was 28% reduction in 1 year. And this is a controlled clinical trial presented by Schmidt in 2021. This study evaluates the early volumetric changes after buccal soft tissue contour augmentation around implants with mucoderm versus the subepithelial connective tissue graft from the palate. And this figure is the clinical operative procedure with the subepithelial connective tissue graft and a mucoderm. And this figure is the presentation of superimposed three-dimensional data sets for the subepithelial connective tissue graft and the mucoderm group during 6 months. And this figure is the three-dimensional outcomes after 6 months of healing for all the subepithelial connective tissue graft and the mucoderm groups. And the volume increase after 6 months was 19.56 cubic millimeter in the mucoderm group and 61.75 cubic millimeter in the subepithelial connective tissue graft group. With no statistically significant difference. The result indicate a volume loss of the initially augmented soft tissue volume of 81.76 in the mucosa group and 56.39% in the sub-epithelial connective tissue graft group after 6 months. The mean soft tissue thickness increase of the barcode contour after 6 months was 0.3 millimeter in the mucosa group and 0.8 millimeter in the sub-epithelial connective tissue graft group. In both groups, the augmented soft tissue volume significantly decreased over time, but the posing collagen matrix used in this study is inferior for soft tissue thickening procedures around implant than the gold standard of the sub-epithelial connective tissue graft. And according to above studies, there is acceptable clinical outcome of mucoderm, and there is a potent acellular dermal matrix similar to mucoderm, which is called ABC color. ABC color was produced employing supercritical carbon dioxide extraction technology to remove cells, fats, and the non-collagen protein and other substances of potent skin, and keep the natural dermis collagen scaffold intact. Is excellent biocompatibility absorb exudates from the wound and keep the wound bed moisture. So next, I'm going to share some clinical cases treated with ABC color collagen matrix at my hospital. And case 1 is a case with insufficiency of vestibule and severe keratinized mucosa with loss due to lots of operation and the need to re-establish the soft tissue for the aesthetic, biological, and functional reason. And after split thickness flap reflection and an apically positioned flap was performed and fixed with suture. ABC color collagen matrix was applied at the recipient bed and was sutured for stabilization. And this is the intraoral photo and 9 months follow-up with a favorable outcome. Case 2 is a severe soft and hard tissue insufficiency in the upper anterior area under prosthesis Pontic. And this TAR technique was performed, and the connective tissue graft combined with ABC color collagen matrix was put into the subperiosteal space to increase the buccal and the occlusal soft tissue volume of this edentulous ridge. And this is the intraoral photo after the surgery. On the left are the initial intraoral photos with severe soft and hard tissue insufficiency in the upper anterior area. And on the right are the photos after 1 month follow-up. And this is the intraoral photo at 6 months follow-up. Also, a minor defect can still be noted. There is significant improvement of the hard and soft tissue volume in the post-operative photo. And case 3 is a case with insufficiency of vestibular and peri-implant buccal keratinized mucosa within the upper left quadrant. A palatally crestal incision, a split thickness flap reflection, and the apically positioned flap were performed to gain the keratinized mucosa width and increase the vestibule. ABC color matrix was put into the buccal flap to increase the soft tissue volume, and also be a wound dressing and palatal site. But during the procedure, the thickness of ABC color was a little thick and make it hardly to put into the flap. And on the right is the photo after the surgery. And this is the intraoral photo at 2-week follow-up. There is significant improvement of the soft tissue volume in the post-operative photo. Case 4 is a case using ABC collagen matrix with tempo technique to increase the peri-implant soft tissue volume. On the left are the intraoral photographs after 2 weeks follow-up. On the right are the photographs after 1 month of follow-up. And this is the intraoral photo at 5 months follow-up. Here we can see there is a favorable outcome. And except for the above cases, this ABC color collagen matrix was also applied in ridge preservation to cover the socket with open healing. However, there are few studies using this kind of collagen matrix for ridge preservation. And this is this randomized control prospective study compares the preservation of soft and hard tissue, the dimensional changes after alveolar ridge preservation, using 2 membranes consisting of collagen matrix, mucosa graft, or intracellular matrix, Dyna matrix, as barriers over freeze-dried bone allograft. The result of the present study indicate that both xenogeneic collagen matrices are effective in maintaining soft tissue thickness and keratinized tissue width when combined with freeze-dried bone allograft for ridge preservation after tooth extraction. The treatment significantly minimized ridge resorption in all dimensions in comparison to previous reported findings recorded after tooth extraction without alveolar ridge preservation. And in this case, lower right first molar was removed and the ridge preservation was performed. Freeze, dry bone allograft and put into the socket. And the ABC color collagen matrix was placed to cover the socket. And on the left is the intraoral photo after 1 week follow-up. Here we can see the degradation of this collagen matrix very soon in a week. And on the middle and the right are the photos after 6 weeks follow-up. The width of extraction ridge was still decreased, but not very obvious after alveolar ridge preservation. And And this is the last case with a severe soft and hard tissue destruction of upper left central and the lateral incisors. It can be easily imagined that there would be severe soft and hard tissue loss after this 2 teeth extraction. To avoid severe ridge collapse, ridge preservation combined with freeze-dried bone allograft and the VIP-CTG was performed. Here we can see the defect was too large to use connective tissue graft only to cover the bone graft and the sockets. So ABC color was also placed at the socket of upper left central incisor for wound closure and the better outcome. And on the right is the photo and suture removal. Compared to intraoral photograph of the initial severe soft and hard tissue defect, there is obvious improvement to maintain the soft and hard tissue volume after 3 months follow-up. And so far, we only have understanding of the short-term stability of ABC color collagen matrix in all of above mentioned cases, and observation of long-term stability is required. So, thank you for your attention.
Thank you, Dr. Chang, for your nice presentation. And